Hello, this is chapter 14, applications. So in this chapter in your textbook, the authors give you 8 kind of stories from innovators around the world who talk about their successes with using solution building practice. So I'm only going to go over them briefly because you're going to have an assignment on this where you're going to pick one that you want to read a little bit more about and kind of put your insight in with that. But we will go over the 8 of them just to kind of give you a little bit more perspective on it. So the first one is Changing Minds, Changing Lives. This was with Kij Burns, a speech and language therapist at Chelsea and Westminster Hospital in London, treating patients with acute events like stroke, head injury, burns, MS, cancer, HIV, etc. So this might be relevant to physical therapists, occupational therapists, nurses, or physicians. And how this could be used in that particular area of work. The medical model often doesn't work well. Feedback to the patient is impairment-based rather than solution-focused. So some examples might be measuring their pain level, not how successful they are in coping with that pain and how they manage to do so. In this particular reading, they talk about the case of Bill. He was 63 when he had a stroke, and then another one 6 months later. So the miracle for him was going to the pub and ordering himself a drink. So, he faced the loss of his normal voice. And there were 6 sessions spread out over a year. And it really helped a lot as far as having these sessions because he and his wife were able to do a pub crawl. So that was good. The whole department focuses on successes with patients in a setting where patient contact may be just 10 minutes with a person, whether they're coming in, getting your vitals and leaving or, something of that sort. On average, it was about 2 to 5 sessions, and the outcome was 95% satisfaction. So that was that story. The second one was the WOW program in Fort Lauderdale. This was working with entire classrooms. The observation was what class and teacher are doing right. The outcomes were informal observations only based off of teacher reports and testimonials, but they were very impressive. It measured tardiness, absenteeism, suspension, and academic performance. In both Florida and Chicago, statistically significant results compared with comparison groups. 97% of teachers who had used it reported that it is somewhat or very effective. Over 60% are using exception questions and scaling even when not using WOW. One school changed a disciplinary room to a solution room. Very interesting. Applying for a grant to do a large clinical trial in suburban schools in Illinois is the next kind of path with that. So this is talking a little bit about how solution focus could be used in the classroom with teachers. So again, another example of how it doesn't just have to be for therapy. Third one was solutions for bullying in primary schools, still talking about the school setting. Don't use the word bullying. Instead, what are you finding difficult to deal with? Who else is around when things are difficult? And who are your friends at school? If they don't have any, who would you like to have as friends? They often name the bully or bystanders who watch the bullying. Support group of names given by the child. There was about 5 to 7 students involved with this one, it was 5 to 7 students, but there were 50 cases. 80% immediately successful and 14% delayed success. So, again, showing some positive outcomes there as well. The fourth one was solution-focused reentry and transition planning for imprisoned people. And this was in Hawaii. The goal was restorative justice outside the criminal justice system. So they would have restorative circles, facilitator training for inmates. It was used in 2 different prisons. In 2010, the Hawaii legislature directed it to be implemented in all Hawaii prisons. So that shows some positive outcomes there. It was rated by all 15 participants as positive. So 100% of the 320 participants said it was positive. And the recidivism rate of 30% versus 54.7% for those who were out for 3 years or longer. The next one was It's a Matter of Choice by Steve DeShazer and Luc Isabert, St. John's Hospital in Belgium. Alcohol abuse, absence versus control. So now we're talking a little bit about addiction. The outcomes were that 132 former inpatients, as far as patients, 13 died, 45% were abstinent, 30% successful in controlled drinking, and 14% did not achieve their goal. So it had similar outcomes for a group of 72 outpatients, and there was no difference in outcomes between those who chose controlled drinking versus abstinence, or for severity of drinking prior to treatment, family support, employment, marital status, or gender. So another aspect of working with people in drug and alcohol addiction. Number 6 was the Plumas Project, solution-focused treatment of domestic violent offenders. So this was in California. However, I don't think it stated that in the text. Domestic violence of offenders, both males and females together. You don't get the information about the nature or severity of the abuse, but the outcomes were that the recidivism rate of 17% after 14 years of data collection, compared with 20 to 50% in the year after program completion, and program completion rate of 93% compared with 50 to 60%. So we see some positives as far as that. 7, solution focus with supervision. INSU talks about how to use solution focus in a supervision practice. If you're looking into going into a supervision job, I would say definitely this is one you want to take a little bit more look into. I didn't really provide a lot of information in this lecture video for you because I'm not sure how many of you are planning to go straight into supervision roles. You may be going into more of like an entry-level role before you hit that supervision role, but it's still in the textbook. So it's interesting to see how solution focus could be implemented as a supervisory role too. And then the last one was solutions for reading, working in a town of West London. This was change in a community through the use of solution-focused teams to improve parenting, schools, and emotional well-being. So there are 8 different aspects that we can take a look at of how solution focus has been used and was implemented in these different areas. And this is across the world too. This is interested in the United States. So I think it's definitely an interesting chapter to kind of read through and see, again, showing proof that the working in this mindset or in this frame of reference can be helpful no matter what area that you plan to go to. All right, well, that is it for this chapter. Thank you for watching.